Quantify how bad some states are spending more on Medicaid than others. In New York and California, I thought it was higher than 30%. This number says 30%. I thought it was 40%. Is that not correct? Up in Massachusetts, Boston?
No. Well, so it's interesting. This gets to exactly the point Tom was raising, which is, what's the number that shows up on the state budget reports that come out each year? And actually look where the money comes from. Mm-hmm. So a widely cited number during the healthcare debate was that states are spending 22% of their budgets on Medicaid. Well, the truth is, if you net out where those funds come from, even not dealing with the game playing, but ostensibly that the money that comes from the state funds versus the federal funds, that number drops to about 12% of state funds go to Medicaid.
Just to give you an example, I'm on the board of the Dartmouth Med School, which we were talking about before. Right. And New Hampshire puts in 0%. Now in their budget, I think it shows up in here as 28%, but it's all air. It's provider taxes. It's all refinanced scam money. If you look at this general ledger of the general revenues in the state of New Hampshire, there's not one penny going to Medicaid, which is outrageous.
What was the dire financial urgency to make Massachusetts pass their law then? Were they really spending money or not?
Well, so Massachusetts took a more comprehensive approach to call. I mean, I don't know the intricacies of whether this is actually going to succeed. Is an open question. There are a lot of details to yet be fleshed out. Really, this law is almost, if anything, a statement of principle as opposed to a lot of the nuts and bolts of it. But it wasn't just about Medicaid. It was really healthcare spending globally in the state of Massachusetts, impacting private insurance and Medicaid as well. So I think Medicaid is part of a larger conversation on healthcare where I think everyone acknowledges that the rate of growth of the healthcare spending in the U.S. is not sustainable. So that's similar to some of the issues on Medicaid, but then there are a lot of other challenges that are more unique to the kind of federal-state balance.
My frustration with Medicaid is that Medicaid, so the biggest program of the federal government is arguably Social Security, which is hard to touch. The second biggest is Medicare, and the third biggest is Medicaid. Medicaid is 56 state and territorial programs. They're completely scrambled eggs. It's so much more in need of reform than Medicare is, or in the commercial sector, which President Obama admirably has tried to reform, whether you agree with the size of the scope of the spending or not. But nobody talks about Medicaid. Medicaid is a management disaster, and every state would tell you that. Now, if I'm a governor, I'm a state Medicaid director, I would do exactly what they're doing, try to maximize the federal revenue and do the best I can. I don't blame them. But when you sit back and look at it structurally, nobody talks about it. For instance,
that's why we're really having this. Yes. As I said in the introduction, Medicare gets the attention, but Medicaid, no one talks about it. It's off the radar, but it's a huge issue.
CMS has 5,000 employees, for example, runs Medicare and Medicaid. In-house, 5,000 employees, 4,000 work for Medicare. Roughly 1,000 work for Medicaid, 55,000 contract employees who all work on Medicare. So the level of effort and policy that goes into Medicaid relatively in the federal government is nothing compared to Medicare. So and the incentives are nuts.
All right, any comments?
And I suppose if you had to go and build that system again, go back 40 years and build that system from scratch, you would not have set it up as a 50-state program.
No, and Admiral, if you look at what's really driven the Medicaid, and he deserves credit for it, I argued with him for years because I don't think he financed it, but Medicaid, when I first got involved, was $12 billion a year back in the 80s. It's now $450 billion. And the guy who gets the credit for expanding most of it, there may be still gaps, is Henry Waxman, who's a member of the Congress, who gradually, quietly, everybody noticed, has expanded these populations and made the program 10 times as big as it was. He did it quietly and nobody noticed. I admire him for trying to help poor people. I always used to fight them because I thought you should pay for it as you go, which is why we have such a big deficit. But the program was started out as a very small supplement to the welfare program originally. And the original estimates were $3 billion a year, and it's turned into a very large program, and I just think it's done so in a very half-assed way.
I have a couple thoughts on that. I think one thing that there's a lot of the budget planning that goes on as to where the funds come from, like you talked about with New Hampshire. But even if we just take it on the face of what states are supposed to be spending based on their state share, it is this smaller number than the number that gets thrown around. The reason it flares into the news as it's unaffordable for states is in part because the design of Medicaid as a safety net program is what we call counter-cyclical. Basically, when the economy stinks, more people are unemployed, more people have no health insurance, more people are poor and qualify for the program. So you have a surge in potential enrollment at the same time that state revenues are dropping. And so that, I think, has as much to do with why we hear the pressure. It's that the forces on the state budgets are happening at the exact worst time for them, more so than whether the number is 12%, 22%, or 5%. It's that
And in defense of the states, there have been a lot of expansions over the last 20 years that were mandated from the federal government, where they said we're going to do all these expansions, and the states didn't have any say in it. They just had to eat it. So they look around and try to find ways to shift the cost. So I understand what's happened. But
you can